An endometrial biopsy is one of the most uncomfortable procedures that we will do in an office setting. There are many indications to have an endometrial biopsy done, so we do quite a few of them. Now, I'm Dr. Monica. I'm a board-certified OB-GYN and mom of 3. I do these procedures all the time. In this video, I want to talk you through the step-by-step process of having an endometrial biopsy done, what you can expect for each point in the procedure, what you can do to prepare, what you can expect for afterwards, and some of the indications for having this biopsy done. So what is an endometrial biopsy? This is a procedure that is done to get a sample of the cells that line the inside of the uterus, also called the endometrium. So if we reference my hand-drawn diagram, it's just a general diagram of the female anatomy. So this is our uterus, cervix, fallopian tubes, and ovaries. This is the vagina. The blue portion here is the lining of the uterus, or the endometrium, and those are the cells, that is the tissue that we aim to sample when we do an endometrial biopsy. There are quite a few different reasons that you might be recommended to have an endometrial biopsy done. Now we're testing those cells up in the endometrium. Most of the time, we're doing this to rule out any type of endometrial cancer or hyperplasia. Cancer, of course, is a malignant invasive process. A hyperplasia is kind of a pre-malignancy in some of its forms, in that it's an overgrowth of the normal cells, meaning it's not a cancer, but it's also not normal tissue. And depending on the type of hyperplasia, different types of treatments are recommended. So most of the time, the point of the biopsy is to rule out one of those cell types. However, it can also be helpful because if the biopsy indicates a polyp or maybe some fibroid, the biopsy can also be helpful because it can indicate if there are certain structures in the uterus. So if the sample comes back showing that there's some polypoid tissue or some fibroid tissue, it would be an indication that those structures might be present in the uterus and could be contributing to whatever symptoms you're having. So knowing that that is the point of getting an endometrial biopsy, what circumstances might prompt you to be having this done? Ruling out hyperplasias or malignancies are often indicated in someone who's having a change in bleeding, specifically heavier bleeding or irregular bleeding. This can be a prompt, especially if there are other risk factors such as age or certain endocrine abnormalities that put you at a higher risk for endometrial hyperplasia or cancer, where it would be suggested to get a biopsy to rule that out. Another very common situation when we do endometrial biopsies is in the setting of postmenopausal bleeding. So this is when a woman has gone through menopause, meaning she's been a whole year with no periods, no menstrual bleeding, and then has had a recurrence of bleeding. This always has to be evaluated very carefully. Most of the time, this is not caused by a cancer or an invasive or malignant process, but because endometrial cancer does have a very flagrant red flag symptom of bleeding, we always have to rule that out. So oftentimes an endometrial biopsy is part of that workup. An endometrial biopsy will also sometimes be recommended if you're undergoing treatment for heavy bleeding and you've decided to undergo a uterine ablation. It's generally recommended to get sampling of the endometrium prior to that procedure, because once your endometrium has been burned with an ablation, it's difficult to get a sample of the endometrium going forward. So we will usually try and grab one before we do the procedure, so we've already evaluated that tissue. So those are just a few of the possible indications for getting an endometrial biopsy. It's not all inclusive, and there is a variance to the indications, and there may be other situations where you should do one, or even if you do have some of those situations I just mentioned, an endometrial biopsy might not be recommended. It all depends on what's going on with you. So let's go through the step-by-step of what an endometrial biopsy in the office entails. So step 1 is going to happen at home before you come in. Before you come to your appointment, about an hour or two before your appointment time, go ahead and pre-medicate with an NSAID. This would be something like a Aleve, Motrin, Advil, ibuprofen, something that has that non-steroidal anti-inflammatory type of medicine is a really good idea to take ahead of time. Studies have indicated that that decreases some of the pain with the procedure and significantly decreases the cramping that comes after the procedure. So you'll already have this medicine on board. You'll come on into your appointment. You will then go ahead and assume the position on the GYN table, meaning legs up in the stirrups, and your clinician will then use a speculum. So this is our dear friend, the speculum. This is what's used to open the vagina and visualize the cervix. Now, the next step depends on what you and your clinician may have talked about in terms of pain control when undergoing an endometrial biopsy. You may have decided to use a lidocaine spray on the cervix, a lidocaine injection into the cervix, or a pericervical block, which is lidocaine being injected in certain areas around the cervix to try to numb some of the nerves that innervate the uterus. Now, it's important to note that not all of these methods of providing pain control have an absolute guarantee of them working, because the area that is being accessed for this biopsy is difficult to actually get a good block or good numbing sensation to. So often there is still pain and cramping associated with it. So at this point, if you've elected for one of those things, the block or the injections or sprays will be performed. Now, the next step can vary a little bit, and it depends on if you are a younger patient who's maybe still having periods, or if you're a postmenopausal patient who maybe hasn't had periods in a while and has undergone the kind of normal changes to the genital tract, which includes a lot of atrophy with the cervix. Atrophy means that the tissue has gotten thinner and is not as pliable or stretchy as it used to be. Now, what I'll often do for this next step is go ahead and try to place our pipelle. So this is the endometrial biopsy pipelle. As you can see, it is a long, thin, flexible tube, and there are measurements down the front that show centimeters, so we know how far it's been inserted. And the end of this tube has a small opening that you can't really quite see, and it also has a suction to it. So this part of the tube is withdrawn, and that creates a suction through this part of the tubing, the goal of it is to bring some of the tissue into this opening so that once it's moved around, it can scrape off some cells into this pipelle. So this is what the pipelle looks like. For me, the next step is I'm gonna go ahead and try to place this pipelle. I'm gonna see if I can get it to go through the cervix and get into the uterus. So if we reference our diagram, this means that this is coming in through the cervix into the uterus. If successful, meaning that it goes through the cervix and goes in a normal length to get to the uterus, then the end of it will be drawn out and the sample will then be collected. So to show you on a more life-size version, this would be the uterus. This is the pipelle coming in through the cervix into the uterus. Now, what happens next is that the pipelle is withdrawn, and this needs to be moved around up in the uterus. This is pretty crampy, and by pretty crampy, I mean very, very crampy, because this has to move amongst the around in the cavity of the uterus, and that edge is scraping off cells to get the biopsy. Now, we like to fill this whole tube with cells, so this can take anywhere from 10 to 45 seconds, depending on how easily the tissue comes off and how much tissue is in there. And while this is in there, there's a lot of cramping while that sample is being collected. Now, that's assuming that the pipelle went ahead and just went right into the uterus. Sometimes that doesn't happen, especially with our postmenopausal patients. So sometimes we do need to do an additional step or 2 steps before that pipelle is able to be placed. The first next step would be to utilize a tenaculum. So this is a tenaculum. It is scary looking. What it's used for is to take this edge and grab a hold of the cervix. That allows your clinician to straighten out the canal of the cervix and the uterus to make for an easier route into the uterus. Now, if at this point the pipelle still won't go through, sometimes your clinician will use some small dilators to slightly dilate the cervix. This is associated with a lot of cramping. Now, once the pipelle has been in and the sample has been collected, the pipelle is removed. The sample is placed into a collection container by putting this back in. This puts the sample into the tube. And then at this point, the actual collection of the biopsy and the sample is done. So if there was a tenaculum on your cervix, it would be removed. If you had any injections or the tenaculum caused some bleeding and any of those sites are bleeding, a medicine will be placed on the cervix so that you're not having active bleeding. This is either a silver nitrate, which is like a silverish gray type of cautery medication, or sometimes Moncel solution, which looks like honey mustard or like peanut butter, and it turns black after it's been in the vagina for a while. So sometimes these things are placed on the cervix or around it at the injection site so that you're not having bleeding. Once all that is done, the speculum is removed from the vagina and the procedure is over. Now, it's common when you have procedures that involve the cervix, whether it's an IUD insertion or a colposcopy or something like this, an endometrial biopsy, it's normal to have what's called a vasovagal response, meaning that you feel lightheaded or feel like you might pass out. So I always ask my patients before they get up, are you feeling lightheaded? If my patients are feeling lightheaded or dizzy, I just tell them to lay down for a bit until that feeling passes, because that is a common response to having your cervix manipulated. It's also really normal to still have some cramping immediately after the procedure and even during the day as the area settles down from having that biopsy collected. It's also normal to have spotting afterwards. And like we mentioned with that medicine that's placed for the bleeding, sometimes you'll see some discharge, which either looks yellow, black, gray, kind of like coffee grounds, as well as some spotting. So there's a lot of discharge that can be normal as long as you're not having heavy bright red bleeding or pus or like green discharge or something that indicates an infection. It's usually normal. So that is the step-by-step process of getting an endometrial biopsy. It is a very uncomfortable procedure. And like many other things we do in the office, some people tolerate it incredibly well and it's over within a flash. Some people have a very difficult time tolerating this procedure. I would encourage you to just be open with your clinician about what you're experiencing. I always tell my patients, if this gets to be too much, we can always call it quits at any point. We can stop and end it, and we can try to go about things a different way. So just be open and have good communication with your clinician for what you're experiencing. Now, this biopsy is often very important to ruling out bad things and allowing you to move forward with different types of treatments or ruling out bad problems. So it's something we do a lot. Hopefully this video helped you prepare and have a good idea of what to expect if you're undergoing endometrial biopsy.